Thank you for joining us today on Health Time TV. Today we're going to be speaking about pain management, and we have Dr. Kavita Gupta here with us from the Institute for Pain Relief from Voorhees, New Jersey. Thank you so much for joining us, Dr. Gupta.
Thank you, Brooke, for having me.
Certainly, and why don't you begin telling us a little bit about yourself and your practice?
Well, Brooke, I'm a board-certified pain management specialist. I practice in sports medicine and pain management. I am the medical director of the Institute of Pain Relief, as you mentioned. I've been practicing for over 6 years in the Delaware Valley area, particularly in South Jersey, in Voorhees, Camden, Berlin, Haddon Heights.
I think the number one question that a lot of people have is, what is the cause of back and neck pain?
Well, back pain is one of the most common conditions as to why they may see their primary care physicians, next to the common cold. When you have back pain, it can be quite debilitating for a patient, and they can actually have a lot of functional decline, missed days of work, and the causes of back pain can be numerous. We can talk about the most basic, a sprain and strain injury. We can talk about a herniated disc, which a lot of people are aware of but may not fully understand. And we can also talk about injuries to the joints in the body and the back, specifically arthritis related, and any other conditions.
And how about the neck?
The neck is very common to the back. It's all a continuous system within the neck and the back. You have to think of the body as being a well-engineered system where everything works together. So if the neck and back are not working together, you can actually sustain a lot of injury. The neck being that you can have similar symptoms and causes such as sprain and strain, herniated discs, and joint arthritis.
How do you diagnose some of these causes?
Well, depending on the type of injury that a patient sustains, you can have diagnostic tests or tests that include x-rays, MRIs, CAT scans, and even EMG studies.
What is an EMG?
I knew you were going to ask. An EMG is an electrodiagnostic study where we actually look at the health of the nerve. We want to see how the nerves are conducting throughout the body. The body is a kinetic system. It's an electric circuit, basically, so we want to see how the nerves are firing. We use the EMG to localize the nerve damage, to see how badly it's damaged, and to kind of give an idea of how well the patient can do in the long run.
When we come back, more on pain management right here on Health Time TV. Once you find out what's causing the pain, how do you treat it?
There's a variety of different types of treatment that are available for treating pain. The first common treatment is using pain medication. That's the easiest way to get the patient quickly out of pain and to minimize their symptoms. Next, we would use rehabilitation. Rehabilitation sometimes, depending on how severe the pain, may go well or may not. And that is purely because of you're putting a patient through a certain range of motion that can be quite painful. We can use other types of treatment, including injections to the spine, to specifically localize medicine to where the problem is and try to relieve the pain quickly and allow them to get functional as soon as possible.
Tell me a little bit about spine injections.
These injections are primarily done with use of either ultrasound or more commonly fluoroscopy. Fluoroscopy allows us to use a live X-ray image to localize a needle to where the actual pain is coming from. We've used all these diagnostic studies to determine that, and now with the fluoroscopy, we're allowed to put the medicine with the use of the needle to guide it safely to an area where the injury is occurring.
How much time does it take to perform the injection, and then when can the patient go back to work?
Typically, Brooke, the injections are done in an outpatient setting, and it can be done within minutes of using X-ray equipment. With proper rest, the patient is able to return to normal activity within 24 to 48 hours.
And how long do the injections last?
That all depends on the type of injury that the patient has. And More oftenly, the injections can last for several months. A patient may require a series of injections, but that is at the discretion of the physician.
Can these injections prevent surgery?
In certain situations, these injections can prevent surgery. It depends on a case-by-case scenario. Patients who are afraid of having surgery or have too many medical conditions that put them at high risk for surgery oftentimes do very well with injections, as the injection is not really a surgical procedure, it is an injection.
Are the injections covered by insurance companies?
Yes, in most cases, insurances do provide this as a service for their patients suffering with chronic pain, and if they're in doubt, they can contact their insurance company to see if coverage is available.
Thank you so much for joining us, Dr. Gupta. I appreciate you being here with us on Health Time TV. And coming up next, we will be joined by Dr. Gupta's associate, Dr. Ali, for more on pain management when Health Time TV returns. Welcome back to Health Time TV, and thank you for joining us on our series on pain management. Today joining us is Dr. Adil Ali from the Institute for Pain Relief in Voorhees, New Jersey. Well, why don't you begin and tell us about your practice?
I am a physical medicine and pain management doctor, meaning that what I see and do is primarily treat non-surgical orthopedic conditions. Any patients with pain, be it of their neck, low back, pain in their hands and feet, are patients that I take care of.
Dr. Ali, tell me about your training and why you got into pain management.
I trained at the University of Michigan as a chief resident in physical medicine and rehabilitation, where I treated patients primarily with non-surgical orthopedic conditions. After that, I worked as a pain management fellow at Harvard Medical School. I got into pain management because of my interest in non-surgical orthopedics and improving patients' overall function. As an avid athlete and runner, I've always had an interest in improving patients' overall function and taking care of their pain so they can perform at the highest level.
So pain is very common to many of us, from headaches to back pain, leg pain, neck pain. What are some treatments that you offer for pain?
I pretty much provide the gamut of pain management services, including a full neurological evaluation, referrals to physical therapy, epidural injections, knee joint injections, acupuncture, and electrodiagnostic studies.
Tell me a little bit about acupuncture.
Acupuncture is an ancient form of healing that originated in China thousands of years ago. Traditional Chinese theory discusses acupuncture as a way to treat energy throughout your body. There's a thought that channels of energy flow through meridians, and there's this life force called qi. Often problems develop in the body related to imbalances in this energy flow, and it's thought that the acupuncture needles help improve balance and overall well-being.
When someone comes to your office to have pain treated with acupuncture, could you walk us through those steps?
After a full neurological examination, patients are usually placed lying on their back or their stomach, depending on where their source of pain is. Thin sterile needles are then placed in several areas along their back or extremities, gently and often stimulated with electrical stimulation or heat.
Are there certain specified areas on the body that you perform acupuncture to relieve certain, I guess, pain that they're having?
There are thousands of acupuncture points on the body, and often a very specific examination helps me determine what points are appropriate to help reduce the patient's symptoms.
Dr. Ali, you mentioned little fine needles on our skin around our body. I would think a lot of people would maybe get nervous and scared, but is that safe to do that to our body?
Acupuncture is very safe. These needles are very thin, they're the size of your hair, they're placed in specific neuroanatomical locations that don't cause much pain. When they're removed, patients don't even know that the needle was actually placed in an area.
Now, why did people choose acupuncture over traditional Western medicine?
Some patients may have conditions that haven't responded to traditional Western medicine, so they're seeking something else. Other patients aren't able to tolerate current Western medicine treatments, such as strong pain medications or muscle relaxants for their conditions. They find that acupuncture is a way for them to receive relief of their symptoms with few side effects.
How long does a treatment normally last?
Typical treatments last 30 minutes. Patients are brought into the room after a full neurological examination. They're either placed on their stomach or their back. Needles are placed in specific anatomical locations to reduce their symptoms. Needles are often stimulated with electricity or heat for 30 minutes. Needles are removed, the patients are evaluated and sent home.
How does one choose an acupuncturist?
You choose an acupuncturist the same way you choose a regular doctor. You can read reviews online, you can ask people for recommendations, you can look to see who in your area is part of a local acupuncture community. A traditional Chinese medical doctor would be listed in one category. Western medical doctors are often listed in another category.
Now, I think the next question, what's on a lot of people's mind is, this isn't, like we said, traditional Western medicine, so is acupuncture covered by insurance companies?
Acupuncture is covered by some insurance companies. It really has to be evaluated on a case-by-case basis.
What is acupuncture most commonly used for?
Acupuncture is most commonly used for pain conditions, which is what I use it for. The best research has been done for pain, such as back pain, chronic headaches, and neuropathy. It's also used for conditions less frequently, such as acid reflux and fertility.
Why would you choose acupuncture over one of your other treatments for a patient that comes into your office?
I combine acupuncture with traditional Western medical treatments such as epidural injections, physical therapy, and medications. I find that my patients do very well with the complementary, holistic approach.
We'll be back for more with Dr. Ali on Health Time TV. Welcome back to Health Time TV. We're here with Dr. Ali from the Institute for Pain Relief located in Voorhees, New Jersey. Welcome back, Dr. Ali. Thank you again for being here with us.
Thank you.
A lot of people were dealing with pain, and what can we do daily, on a daily basis, to ease pain, whether it be probably, I would say, primarily in the back?
In order to optimize your overall health and reduce pain and reduce the incidence of developing pain, we need to be in the best shape possible. Particularly, let's talk about back pain. Low back pain is one of the most common reasons people present to the doctor, with the exception of the common cold and I think headaches. And in order to prevent back pain and to manage back pain, core strength is really important. By core strength, I mean the muscles in your stomach and your back. I often see patients and provide them with an exercise regimen for their back to help treat their pain and prevent pain.
Many of us are lifting on a daily basis, whether it be women who are going to the grocery store or on the weekends we're lifting and picking up our kids. What are some proper lifting techniques that we can do so we don't strain any of the muscles in our body?
Proper lifting technique is a key to preventing back injury. The first thing you should assess before lifting up an object is you should have an idea of how much the object weighs and where it needs to be placed. First, approach the object. Have it lined up in front of you as close to you as possible. Your feet should be at roughly shoulder width. Bend at both of your knees to pick up the object, keeping your back as straight as possible with a natural curve. Another variation would be to bend at one knee and have one knee touching the ground. Next, you should lift the object up, making sure you breathe out and contract the muscles of your abdomen. Keep your back as straight as possible, again with a natural curve. As you're holding the object, make sure you don't twist as you're coming back up. Often people injure their backs when they're bending forward and twisting.
Welcome back to Health Time TV, and now it's time for my favorite segment, Viewer Email, where you, the viewers, can write in and have the doctors answer your questions. You can do this by emailing us at questions@healthtimetv.com. Our first question is from Krista in Wayne, Pennsylvania. She writes, I'm a receptionist and I have numbness and tingling at night in my hands. What should I do?
Krista, it's possible that the numbness and tingling in the hands is related to a nerve being pinched in the wrists. This can be called carpal tunnel syndrome. It's a repetitive overuse injury. Often people who are receptionists or people who work with their hands doing a lot of repetitive gripping can develop an irritation of the nerve in their wrists. I would recommend an evaluation by a physician, which would include a neurological examination and a test of your reflexes to make sure this isn't related to a nerve being pinched in the neck or anywhere else in your body. In addition, an electrodiagnostic study, which is a test of the nerves and muscles in your arms, can help determine the health and location of the nerve being pinched. In addition, an ultrasound study may be helpful to show if there's any inflammation of the nerve in the wrist.
Now, if somebody determines that Krista does have carpal tunnel syndrome, what are the treatments for that?
Treatments can include a brace, a neutral wrist brace that keeps your hand Basically, a set, steady position that you can wear at night, sometimes at work. In addition, physical therapy and occupational therapy may be helpful to provide the patient with stretching exercises to do. In addition, therapies such as a local steroid injection in the wrist can help reduce inflammation around the nerve. If symptoms are found to be particularly severe, surgery is also an option to help provide the nerve some more space and reduce compression.
Can acupuncture be used to help with carpal tunnel?
Acupuncture can be used to treat carpal tunnel syndrome. It can help improve circulation in the area and reduce pain.
Thomas from Upper Darby, Pennsylvania writes, I have struggled with headaches and neck pain for years. I've tried everything. What should I do?
Thomas, if your symptoms have continued after a full neurological workup and imaging of your head, it's possible that your symptoms are related to arthritis in your neck. Often, painful neck arthritis can result in pain radiating into your head. An MRI of your neck and diagnostic and therapeutic injections may be able to help reduce your symptoms and improve your function.
Next we have Tracy from Morristown, New Jersey. She writes, I'm an avid tennis player and have elbow pain that hasn't improved with steroid injections. Are there any other treatments available for me?
Tracy, it sounds like your symptoms have continued to bother you despite the typical treatments available. What I recommend, and what's often provided for people with recalcitrant elbow pain, is something called regenerative injection therapy. This includes and is described as the injection of a sterile sugar solution into your elbow area to help actually promote inflammation and healing of the tendons of your elbow, which are quite possibly inflamed and have not completely healed. Another regenerative injection therapy is called PRP. It's platelet-rich plasma therapy. This involves taking a sample of your blood, spinning it down until you have a solution full of nutrients. This is then injected into the painful area, such as your elbow, to help promote healing, which hasn't completely completed itself.
Jared from Sicklerville is next, and he writes, is ice or heat better for my knee pain?
Jared, every patient's different and everyone's body responds differently. I find that for chronic problems, heat may be helpful. If you have an acute problem or sprain or a strain in a joint that's swollen, ice often is most beneficial in reducing inflammation and pain.
We now have Paul from Pemberton, and he asks, I have developed a stomach ulcer by taking too much ibuprofen for my arthritis. Is there anything else I could try?
Paul, one promising supplement that actually is just as good as anti-inflammatories are omega-3 fatty acids. They've been shown to work just as good as ibuprofen for inflammatory-mediated pain, such as arthritic pain.
What are some things that have the omega-3 acids?
Omega-3 fatty acids can be found primarily in fish oil. You can also get them in flaxseed and krill and various types of nuts.
Next is David from Newtown, Pennsylvania, and he writes, I tore my rotator cuff and want to avoid surgery. What other options are there for me?
David, regenerative injection therapy sounds like it would be able to provide you with some relief of your symptoms and help promote healing. Regenerative injection therapy involves the injection of either a sterile sugar solution or your body's own platelets into that area to help promote healing.
Naomi in Doylestown, Pennsylvania says, I have headaches and neck pain. My doctor told me I could use Botox for this. Is this true?
Naomi, Botox is now FDA approved for migraine headaches as well as cervical dystonia, which is neck spasms. I recommend that you see your doctor for an evaluation in order to determine whether this will be a good treatment for you.
I think that's so amazing that Botox for cosmetic surgery and now related to pain. It's very amazing. So Jill from Westchester, Pennsylvania. I'm 5 months pregnant and have been struggling with back pain. What should I do?
Jill, I found that acupuncture is a great way to treat any type of pain or complication related to pregnancy, whether it's carpal tunnel syndrome, which is numbness, tingling in your hands, back pain, or sciatica. It involves the use of thin, sterile needles. They're removed, and there's little to no pain afterwards.
So one more follow-up question, not from a viewer, from my own standpoint. How does one know what is the level that I need to reach in my pain to know that I have to come to a pain specialist?
If you have pain in any way that limits you in your functional activities, you should see a pain management specialist for a full workup and evaluation.
For more local health and wellness information, please visit us at healthtimetv.com.